Um, okay, I want to welcome everybody here today to a press conference that was called by the Ontario Coalition Against Poverty and the Toronto Harm Reduction Alliance to talk about this crisis around the opioid deaths that are happening in our city presently. My name is Gaetan Héroux. I'm a member of the Ontario Coalition Against Poverty. I'm going to MC. We're going to have a number of speakers that are going to speak that I'm going to introduce. And then after that, we're going to take a very, very short walk to drop some flowers at a very particular place. I want to start by telling people why we chose this area or this corner over at Seton and Dundas Street. On June 22nd, I was walking on my way to work down Seton Street to Fred Victor around 10:30. As I approached the alleyway over here just behind us, I saw some yellow tape. Both the front end and the back end of the alleyway were closed with cop cars inside. Something was going on. I couldn't go back there and find out. I continued because I had to go to work. But then when we began to inquire what had happened, we found out very soon, because a lot of people know each other, that what had happened is that that day a 27 Aboriginal man died in that back alley, and we found out that he OD'd there, and we lost a person in our community. We know his first name is Carl, we know his last name. Many of us knew him. And the reason we want to bring to attention that death is because Carl died that morning or that night in the back alley, and no one in the city council, the mayor, the police didn't speak out, the fire department didn't speak out, the coroner's office didn't speak out. And it's left up to us in the end to speak up about what's going on. Before I introduce the first speaker, I just want to stress that for many of us who have worked in this area, I've been down here for 30 years, since 1988. We've had a situation now for decades where the city has abandoned a large number, tens of thousands of people have been abandoned to a life of poverty. For decades, people have been neglected, not just at Dundas and Sherbourne, but across the city. It's very visible here because we have this large number of household beds, and we see it. And we have to talk about that neglect. We have to talk about what is happening. Why are we having this crisis? It's part of a larger issue for us. In the short term, we have to address. Some people are going to speak about what we have to do to make sure we don't lose more people. But more importantly, we have to talk about the fact that we have no housing for our people. On a daily basis, hundreds and hundreds of people go to these agencies here at Street Health, at Regent Park, Dixon Hall, looking and saying, where can I find housing? That happens on a daily basis. On a daily basis, people tell us they have no money for food. They come looking for tickets for transportation. You cannot leave people in these kinds of conditions for year and year on end. You cannot have situations like Seton House, Maxwell, Megan, where the shelter is overcrowded in intolerable conditions. You can't allow that. You can't shut down, on an average, 2 units of Toronto housing, 2,000 units every day. They're talking about 1,000 units. That's an average of 2 a day. You can't have 2 people a week dying on these streets. So what we're seeing right now around the opium deaths is kinetic to that. And we have silence from the mayor's office and the councillors about what are you going to do to address the pain and the suffering and the fact that people are self-medicating because they can't handle it anymore. They're losing hope. So what are you going to do? We have some solutions today in terms of the short term, but in the long term, if you're going to stabilize people, we need to have housing, affordable housing, and enough money to live on. Our first speaker will be Zoe Dodd from the South Riverdale Community Health Center from Toronto. Yeah.
Hi, thank you. I just want to acknowledge Carl because I was Carl's worker for a number of years, and I also worked with his uncle, and that was how I met Carl. And he was a really good man who struggled with the system that we live in, and it's hard for us to connect it, and we are constantly just blaming this on fentanyl, but it actually isn't what's killing people. We are in a drug war crisis. We are in a crisis of peril. We are in a crisis around homelessness and people's vulnerabilities that is escalating the crisis that we're in, and that's why we're here today trying to connect the issues and connect them for those in power. So I was at the mayor's meeting last night, and it was good that the mayor had brought some of us from the front line in to talk to us, but there are so many agencies within the city that are working on these issues, working with people who use drugs, working with people living in poverty. And more people actually need to be at those tables. Actually, we invited the mayor to come and see what's actually happening in the community. He needs to leave the office and come and walk around and see what's actually going on. We have no coordinated efforts that would actually, this is a public health emergency. The kind of efforts that we need are the same that you would use in a pandemic flu. These have not been enacted, and these are the things that we have been demanding and asking for. The mayor was going to speak today to Eric Hoskins, and we asked him to ask Eric Hoskins to get Premier Kathleen Wynne to declare a public health emergency. It's purposeful, the language of politicians, to call it a crisis. To not call it a public health emergency, which is what it is, means that they don't have to enact the resources that we actually need to get a handle on what's actually going on. It is uncoordinated. So in the middle of the meeting with the mayor last night, 2 of our coworkers had to leave the meeting because there were 2 overdoses at the center with which they work in. If that is not real as to what is actually happening here, I don't know what to tell them anymore. But we are very done with pleading and begging and crying at their tables as we are exhausted. Watching our coworkers die is what we were telling them. Our coworkers at our sites have died. We don't have enough resources to be open 24/7 or to do the outreach we need or to get naloxone to people or the overdose prevention and education that people need on the streets. We can't get people into detox beds. We can't get them into shelters because they're over capacity. We can't get people into housing. And meanwhile, all this is going on, people are dying. We asked the mayor to think about decriminalization, to get police to not come on overdose calls because people are still afraid to call 911 because they are scared of the police showing up. We asked the mayor to think about decriminalization, to stop drug busts at this time. We have a toxic supply of drugs on the streets that we can't even test. At this meeting, we talked about that we don't have real-time data, that we are going to look back in 2 years and see how many hundreds of people have died in this province, and it's absolutely devastating. That was our meeting last night. There were only about 16 of us there, but there are so many people in this city working on this issue. This is a crisis. This is systemic. This is peril, people living in peril. And we cannot afford to let people die. Their lives have value. And the young man who died in that laneway over there, his name was Carl. He was 27 years old. Every death is an event. And that's what we told the mayor last night. And we are sick of pleading and begging, and we want action. We need it today. We need it right now. We need those resources, and that comes with money. We need the safe injection sites open. The Liberal government is screwing around with whether we could have this staff or that staff, what the operating costs would be. They said we could have 100% of that funding. That needs to come today. It takes time to open those. We are going to take some matters into our own hands as workers because we have to. We have been left to do things on our own, including getting naloxone to give to people. The site where the 2 overdoses happened yesterday, they don't get naloxone from this city. They didn't. Those staff took it upon themselves. They are getting naloxone from South Riverdale Community Health Center. They should be getting it from the city. They should be getting it from the province. This is not coordinated. This is not actually how you do things in an emergency. And we need the mayor to hear this. We need every single politician to hear this. And we need them to be working together, because they are not. All levels of government are to blame right now. All of them, for leaving people in this much peril. And so we're going to hear more voices today talking about that, because enough is enough. This is a public health emergency.
Before I call the next speaker, I just want to tell people that we have a number of speakers today from across the city. There are people who have come all the way from Parkdale to speak today. Community workers, people who, and it's very important for us to begin to talk about this stuff. And for us, it's not important also. It's very good for me to see these workers out here today, because you might not know this, but often the agencies that we work with won't let us talk about what is happening. And that happens often. So the next speaker will be Signe Dewar from the Toronto Users Union. I hope I pronounced it.
Users Union, yes. Hello. Everybody's been so articulate. I really don't have a lot to add, except that I'm a drug user, and fortunately I have a partner, and we always use together. And I have a naloxone kit, and I've educated myself about how to use it. But not everybody out there has a partner. And it's easy to say, why don't they just grab somebody to use with? But it's, you know, you don't want to have to share your heroin. I don't understand. There's a simple solution to all this. Decriminalize it. And then you get clean drugs. You get people will be able to have a recourse to what kind of drugs they use, instead of having to go to the streets. Decriminalize it. It's the only sane response to this. I don't understand why that hasn't been done by now. It would get rid of drug dealers. It would get rid of the money being made on the black market. It would just decriminalize it. It's, you know, and look what happened with Portugal. Everybody always mentions Portugal, but Portugal has not had an sudden increase of heroin users, and it decriminalized it. So that's what I have to say. Just get it decriminalized. I'm tired of people dying, you know? It's not necessary.
Thanks, Sidney. So our next speaker is Greg Bell from the Regent Park Community Health Center Harm Reduction. He was a harm reduction worker.
Good afternoon. My name is Gregory Bell. I'm a current drug user and a member of this community. I've been a member of this community for about 40 years, and I've seen a lot of people die from drug use since I've been here. Anyways, my name is Greg, and I'm a harm reduction worker at Regent Park Community Health Center. I am disappointed and discouraged with the lack of immediate response to the current opioid crisis, and we are faced with the city and provincial and at the federal level. We've been losing lives due to overdose for way too long. It's a devastating loss, and it's only going to get worse. All these deaths could have been prevented. Again, I've been using drugs for 40 years, and I've seen many of my fellow drug users die before harm reduction was even an option. We need action now. Every day we hear about a new person who has overdosed. Some of these people are people I've known for a long time, and it breaks my heart that their drugs are too strong and that their lives are not being held accountable for by the politics at municipal, provincial, and federal level. We need to put a stop to this. Harm reduction is the answer. Us drug users need to be a part of the solution. We need safe injection sites to help our community members use safely, not in the fall, but now. We need access to safe opiates like prescription heroin and hydromorphine. We need everyone, including police and firemen, to be carrying naloxone. We need funds to this to be released as soon as possible. Before real change can be seen, we need to address the lack of shelter and housing and to end the war on drug users, not the war on drugs. Homelessness put people at high risk for overdosing. We need to raise the rates of ODSP and welfare, reduce TTC fare, and increase funding to harm reduction services to empower the lives of drug users in a social and economic sphere. They all go hand in hand. And last but not least, I hope this message gets through to our mayor, our premier, and the prime minister, and that they open up their minds, eyes, and hearts and see us as equal partners in society, and to think outside the box and not to think in terms of political alliance or religious constraints, or free their minds and think clearly. Thank you.
Thank you.
Okay, our next speaker is Gomo George, who's a frontline worker in the downtown east. Gomo.
Yeah, hello, good afternoon. I'm a drop-in worker. I've been working in the neighborhood for about 9 years. I have to say the crisis is not new. It's been going on for some time. Before fentanyl, we had Oxycontin. What's happening now is people are dying at a faster rate. In the last month, we've had 4 memorials in our drop-in. That's 4 people that we knew very closely who have died, and most of them died alone. You know, we understand that people are distressed. We understand the history of our society. We understand why people are distressed and why people use. What we don't understand is why are all these poisons on our streets and what are we doing about it? We hear about the drug addicts. We hear about people on the street corners. We hear about dealers who are actually runners, right? But why are these poisons on our streets? We know where they're coming from. You know, we live in the land of the one spoon, one palm, right? This is a place that was built on generosity and sharing. So now as a society, I think we need to stand up, take example from the native people who lived there in the past and look after each other. Because that's what we're not doing. We're not looking after each other. We need more treatment centers. We need more detox centers. You know, we need housing. We need people to be safe. I mean, I don't know how many times we can say that, in how many ways, so that the people in authority, the people who hold the purse strings, will understand. I just want to say again, the crisis is not new. People are just dying in greater numbers. Thank you.
Thanks, Como. Our next speaker is Peter Leslie from the Toronto Harm Reduction Alliance.
Thank you, Gaetan. Thanks. Yeah. Okay. These have been really sad days for us. I'm Peter Leslie from the Harm Reduction Alliance. The Harm Reduction Alliance wants to thank OCAP for being the driving force behind today's press conference. And why OCAP? Because poverty and drug use, illicit drug use or any drug use, is tied. We are partners in this struggle. And I'm not going to go on about the social determinants of health and whatnot, but the thing is, poor people are dying, and now perhaps it's affecting other classes of people as well. And the cynical part of me is thinking, wow, there's some outrage now. There's been outrage and despair in our community for decades. And I know the 2 young women at 427 and Evans Road is still undetermined, the cause of their deaths. But you know, this defies class distinction. People are dying in droves. Mostly our people who work in the community that the Harm Reduction Alliance supports and serves and educates. Community health. All the community health centers around this city support and serve poor people, marginalized people, people who are in need. They may or may not be drug users, but many of our people happen to be. I too am a drug user. I've been a drug user since the 70s, whatnot. There needs to be a coordinated, nuanced action plan. We have a provincial action plan that was rolled out by Hoskins and David Williams. We have a very robust overdose action plan that the City of Toronto and Toronto Public Health has created with the help of community health, people around this site here today. But what I think is underlying is that we are so out of communication. We need we need to be all on board here with this. Over 2,000 people died of just opiate-related overdoses alone last year, the calendar year in Canada. I'm not thinking, you know what, it's too sad to think about the people we've lost sometimes. It's overwhelming. I'm worried about the people that may die this weekend or next week, because it's hurry up and rush and get these SISs up and running. I hope we save dozens of lives with SISs, but this is just one component of the overdose action plan. And you know, we need a really committed, we need like action. An overdose action plan requires action, requires funding. I want to remind everybody what happened in 2003 with the SARS outbreak. Different circumstances, it was a virus, but it was such mobilization. The whole country was mobilized. And dozens of deaths that year. It was horrible. We're losing dozens of people across this country weekly. So I just want the larger public to know that this isn't just about homeless injection drug users. This is about the entire country. And in Toronto in particular, we need to really dig deep here. So thank you very much.
Thank you, Peter. Just so you know, we have 4 more speakers. We're almost there. And I encourage people who are here to stay, because after this is over, we're going to drop some flowers where Carl, in the general area where Carl died. So, but we'll do that after the press conference. Monica Forrester, community worker with Street Health. Thanks, Monica.
Yeah, no problem. So hi everyone, I'm Monica Forrester. I'm the mental health worker at Street Health, but I also work with Maggie's Toronto Action Sex Work Project. So I've actually been working in services for 20 years, but actually been involved in the community for 30 years. So I've been part of that community up to now. I thought it's very important for me to be here. First, I've lost a few friends within the LGBT community that have died recently of overdose. And also, this is probably the worst crisis since the AIDS epidemic we're seeing with people dying, and it's something that needs to be taken seriously. The mayor needs to step up and get these things in place that we can actually get these injection sites in place. I'm here to speak. I can go on and on and on. So, I'm here to speak on the response to the Mayor of Toronto's response to the opioid crisis here in the city. The mayor has indicated that safe injection sites will be open next month in the city of Toronto. As a frontline worker, the mayor isn't moving fast enough on this crisis of people in our city are experiencing overdose and are dying due to the fentanyl being laced in drugs people are using. The crisis has been going on for months in our city. There's no immediate protocols in place to guarantee the safety of our neighborhoods, our brothers, our sisters, our parents, and our loved ones. Many agencies on the front line have made priorities to make sure all staff are trained and ready to address the opioid crisis that's happening in our streets, in our drop-ins, agencies, and throughout the outreach that outreach workers do at night. Most of this work is being done with zero additional funding to carry the burden of this crisis. This is still not enough. The city is not taking the crisis seriously due to the populations that are affected, and we talked about that today, by the epidemic. Currently, there is no safe space for people to go use or even after they're using. No safe space for people to use safely. We need the city to open safe spaces now. We can't wait till the fall. The recent delisting of certain medications only impact the poor and is not harm reduction focused. We're asking that all healthcare providers to ensure all opiate users have low barriers to access prescriptions of heroin or hydromorphine, and low barrier harm reduction focused shelter beds in the downtown core. More funding for 24-hour drop-ins like Sistering and Fred Victor. More funding to open safe night drop-ins for all people in our city. We demand as community workers and citizens of Toronto that you act on this crisis immediately. Everyone's lives matter here. No more deaths, No more lost community members. Thank you.
Thank you, Monica. Next speaker is Frank Coburn, formerly a homeless community member with lived experience who sits on the committee advisory committee for the SIS and the works.
Hi, good afternoon, everyone. I'm happy to be here for several reasons. Unlike the great Donald Trump, I'm a big fan of the media, so you don't have to worry about me bad-mouthing you. I think one of the great assets of our free Western society. I can best describe myself as a community member. I used to live in this area for quite a while. At least I used to hang around in this area for a while. I was homeless at one time and used to roam these streets up and down, so I'm very familiar with this area, an area which I love very much. I am also a user of all the services around here, being a person who still uses drugs myself, even up to this day. And I'm not ashamed of it. Not that I try to glorify or justify my drug use, but I'm not ashamed of it. I happen to sit on the Community Advisory Committee of the Works, as well as on the Advisory Committee of the Safe Supervised Injection Site of the Works. And I happen to have sat on the panel, on the committee that drew up the Toronto Drug Strategy Report, a document of which I'm very proud to have been a part of. I overdosed myself once at Seton House, and it was only through sheer luck that I'm still standing here today. On another more bright note, if you want to put it that way, a friend of mine OD'd in my own house recently, and we brought her back out of it because I had the training and the naloxone to be able to do that. So I think we want to stress the importance, first of all, of universal use of naloxone, and there's nothing to be ashamed of. I like to remind people that this is Toronto. This is the year 2017. This is not 1817. Same-sex relationships are no big deal today. We're legalizing marijuana soon. All right, let's get with it. I want people of other societies, other nations, other countries to look at us and say, well, listen, the guys in Toronto really know what they're doing. We approach these kinds of situations in a more compassionate, more humane manner. I want them to look at us as an example, not us to look to those regressive steps in other parts of the world. There is an epidemic, an overdose epidemic in Toronto and the whole of North America, as a matter of fact. People are dying every day, and we have to do something about it. We can't just ignore it and put our heads in the sand and pretend that everything is all right, because it's not. It's needless. These are needless deaths, and deaths that can be that can be avoided. We have to get out, as Dr. Gabor Martez says, out of the straitjacket thinking of abstinence-only approach to drug use, please. It's not the only way to do business. We have to look at the scientific data that tells us that proper use and harm reduction interventions go a long way towards saving lives and stabilizing society and stabilizing community as a whole. Our friends are dying, our brothers, our sisters, our loved ones are dying on a daily basis, and we have to do something about it. So let us talk to our councillors or MPs or MPPs. Let them know how we feel about this whole thing. And there are examples. The Naomi Project, the North American Opiate Medication Initiative, that done a few years ago by Dr. Benedict Fisher of CAMH, proved conclusively that if you handle drugs, especially opiates, in a proper, constructive, humane manner, good things will happen. Good things will happen. Right here at home, the Crack Users Project, which is, I don't think it's still around, that came out of Regent Park, showed what can be done, what positive things can come out of situations where people who use drugs and people who are homeless, if they're given a lot of respect and allow their self-esteem to rise, they can move on and their lives can become quite stable. What we need is supports. And of course, the biggest issue of all, as far as I'm concerned, is the decriminalization of all drugs. I have taken the word enabling out of my lexicon and threw it in the garbage years ago. I do not want to be concerned or waste time trying to figure out if I'm assisting someone in using drugs or if I'm just helping to keep the community safe when I give him a straight a safe injection kit or crack smoking kit. a really great example of what decriminalization can do, of the wonder of decriminalization, is Portugal in the year 2001, who decriminalized all drugs, cocaine, marijuana, heroin. And right now in Portugal, hardly anyone dies from an overdose. As a matter of fact, I was looking at the statistics, and in Portugal, 3 people out of every million die of drug overdoses. In the Netherlands, it's a figure of 10.2 per million, and in Estonia, 126.8 people per million die of overdoses every year. I do not know what the figures for Canada and the USA are, but I'm sure they probably are significantly higher than that. I want us to look at it more carefully, to realize that we are a society, we cannot stop drug use. Not that we encourage drug use, but we want our people who use drugs to be safe. We want people who use drugs to be making a more major contribution to society, and we want us all to set an example to the rest of the world that we, in fact, here in Canada, especially in Toronto, care about our citizens and that we are more humane and compassionate than many others are around us. Thank you very much.
Thank you, Frank. Our next speaker is Patricia O'Connor. She's the Executive Director of Sistering.
Good afternoon, everyone. I'm from Sistering. We run a 24-hour, 7-day-a-week drop-in for women. Women who are homeless, women who have mental health issues, and women with addictions. This morning at Sistering, we held a memorial for one of our young women who died. This woman spent a year living in a tent at the R.C. Harris treatment plant. She spent time living in a tent in Hyde Park. And the day before she passed away, we were this close to getting her housing. And she died. We had that meeting on Friday. She died on the Saturday. This city is not dealing with its vulnerable population. If you were to come into Sistering, you would recognize the women there. You'd see your mom, you'd see your sister, you'd see your grandmother, you'd see your old Aunt Edith. We serve women from 18 to well into their 80s. They don't have homes. They sleep on the floor at Sistering. We're not a shelter, we're a drop-in. They get a mat on the floor if they're lucky, or they get a blanket on the floor, and they get food and access to a shower. This is not right. The city politicians, the provincial politicians, and the federal politicians are just failing our most vulnerable people. Now, I deal with women. That's a similar situation for men right across the city. Women's shelters are 99% full. Every night we are at or over capacity in terms of giving people shelter. We have women that stay at Sistering months at a time because there is no housing. There's no place for them to go. Zoe was talking about this being a public health crisis, and it is, but politicians, and I'm pointing particularly at the city, because I'm just beyond myself with the years and years and years of no raising taxes, maybe at the rate of inflation, maybe not. We need, if people walked into Sistering and saw the conditions in which people live day after day after day, I think they'd race down to City Hall and say, raise my taxes. Women should not live like this. It's not right. And I've written to the mayor personally a couple of times. I've been part of coalitions that have gone to City Hall to meet with the mayor. He hasn't met with us. He didn't come out to accept a letter. Someone came out and took it. We've had no response other than the typical, thank you for writing, Mayor Tory, we will think about your situation or whatever. That's the only response we get. Now, some members of council do understand this issue and are trying to make change, but it's not coming fast enough. These safe injection sites need to be open. They were approved months ago, and if the city really wanted to get them open, they have a huge bureaucracy of people, tradespeople, and people that do this and do that. The private sector could come in. It can't be perfect. We need to open a site now. I'd be happy to have Sistering as a safe injection site right now, staffed by our harm reduction people. We need to get the women and the men out of the alleyways, out of parks, and into a safe place. What can I say? I'm beside myself with the lack of political action, and we need it. We need it yesterday. And I'd love Mayor Tory to come down and walk through Sistering and just see. He would see his mother there, or try to imagine what it would be like if Elizabeth was lying on a mat in Sistering. So I hope you folks, members of the press, can get our story out, hold our politicians at all levels to account. The housing situation's deplorable. There's no shelters, no affordable housing. There's rooms that are being charged like $600, $800, $900 a month. These people can't afford it. They don't have money. So it's time, it's beyond time. Let's get some action going.
Thank you, Patricia. Okay, our last speaker is Natalie Cadio from the Queen West Community Health Center in Parkdale. From the Parkdale, Queen West. I hear you got together. Okay, from the harm reduction program.
I'm sure I'm not going to say anything that hasn't been said already, but what we need right now, we're exhausted and tired, is a public health emergency to be declared, and this to be actually treated like a public health emergency. We are waiting, we are in meetings, we are on committees, we are tired of waiting for things that should have happened. If this was any other community under such duress and murder, then we would have immediate action. But because it's people who use drugs, it's slow and like molasses, and we are very, very exhausted. We sat down with the mayor last night and spent 2 hours, a group of us, a select few, representing our communities. Drug users weren't at the table as much as they should have been, but that's who needs to be listened to in this crisis. And we told him everything that we need. We listed it. There were dozens of us in the room who just went through everything we need, and we need it now. We need it yesterday. Supervised injection sites are a huge part of this. They're not the be-all, end-all, but we need them open yesterday, and the province is sitting on money that could help Parkdale Queen West open at the Queen West site, and South Riverdale, people can't get ready to open them because we don't have the money. So construction needs to happen, but we could be hiring staff and training them right now so that they're ready to hit the ground, and they could be helping out right now. We need pop-up sites. We need sustainable, long-term solutions, including dedicated harm reduction funding. We can't be doing this under the auspices of HIV and hepatitis C money that we piece together, or innovative programs. We need to do the things that we do well every day. We also need the media to take some responsibility in this crisis, because the hype around corrections officers allegedly being poisoned with fentanyl that they've breathed in the air or touched with their fingers, those sorts of stories don't help. They actually increase the stigma against people who use drugs, who are overdosing, and make people reticent to help in a crisis. So also, the constant showing of transdermal patches, fentanyl patches, that isn't the fentanyl that we're dealing with here. That's safe fentanyl, and we could teach people how to use that properly. What we're talking about is a toxic drug supply, and we need to get rid of it. We need prescription heroin, we need all sorts of things, and everybody knows what we need, but nobody will give it to us. And this has to happen. It has to happen now, and people are dying. I know of one overdose that happened in Parkdale this morning already, reversed by a community member who had naloxone. There are tons of community members who don't have access to naloxone. During the meeting, 2 people had to leave the meeting because there was an overdose at their agency. 2 overdoses at their agency. So these are things that we're like in between dealing with death and holding memorials. We're trying to piece together a strategy that should have been done 10 years ago. So that's all I have to say. I just hope that people act and stop talking about it. We need it now, and we need the political will. We need the community to get on side and realize this is members of your community who are dying every single day. So do something.
Okay, before we go, I'm just going to close up, and then we're going to take a couple minutes to walk over. One of the things that this press conference has accomplished today is it has given a name to this young man that died on June 22nd. His name was Carl, an Aboriginal man, young man, 27 years old. And many of us in the community walked around with this knowledge. And as more and more people began to die, it really, really was troubling to know that that had happened here. And that the mayor doesn't know about this, that the councillors don't know about this, that the city doesn't know about this. So at most today, the city knows. And they've known for a long time, but now they know. And they know about this death that happened almost 5 weeks before this crisis occurred. And it's important that they know. Secondly, I think a whole bunch of speakers have spoken about what we need immediately. I won't go through the list because they've spoken. The demands are there. Thirdly, I really want to applaud the agencies who came out today and actually put their names to this press conference. And that's Regent Park Community Health Center, Street Health, Queen West Parkdale Community Health Center, and Sistering. Because it is essential the people who run these agencies allow their workers and the people to talk about what is going on these streets. Some of us have talked about these deaths for a long, long time. The Ontario Coalition Against Poverty have been fighting this stuff for a long time. And when we try and get some of these agencies to come out, they refuse. Some of the bickering now is about whether or not you should decriminalize or what it should be. The hell with that. Your people are dying. Carl, use your services on a daily basis. So you come out and talk about that. And if you won't, let us do it. Because that's enough. So lastly, we're going to take a walk. And for me and some of us, it'll be very important because this is, today, I mean, my image was, okay, something happened there, now we know. And now we know that we've spoke publicly. Enough backroom buildings. Some people will call into the mayor's office and they will go there. But we will take to the streets. If more people die on these streets, we will go and take to the streets. And every time someone dies, we'll come back. And we have people from Parkdale, West End and East End, and we got together and we'll get bigger and bigger. Because we will not watch our people die in the streets.